Thrive Talks, presented by Power to Thrive by L.U.N.A Incorporated, which is a nonprofit which is committed to the empowerment of girls and women through interactive workshops, coaching, as well as conversations like this about us, for us. And we're here today with some lovely guests that are going to generate our conversation about women's health. And in particular, today, women's health is specifying vaginal health, right? And all the things that come with that at different stages and different ailments. And we'll start with Allie Leffridge. Tell us who you are and a little bit about yourself, please.
So my name is Allie Leffridge. Allie short for Alexandra. I'm a former Division I, Division II basketball player. I got my master's degree in public administration in 2021. I've been working in the field of economic development for the last almost 5 or 6 years. I currently work for a national organization and a local organization in Philadelphia. And as of this summer, I will be a full-time nursing student.
Congratulations.
Congratulations.
Hello, everyone. My name is Sophia Camulaire, and thank you for joining us. I am a student at Stony Brook University, a graduate student studying public health under the Health Administration Masters. And I have experience living as a woman who has PCOS, and I will be sharing my journey with you all today. So thank you so much.
Thank you so much. And Shaytonya, welcome.
Hi, everyone. I am Shaytonya. I'm a board certified women's health nurse practitioner. I did my undergraduate studies in nursing at the Pennsylvania State University, way back yonder, and did my graduate studies at SUNY Downstate. I've been a nurse practitioner since 2011, and currently I have a private practice in which we made our 4-year anniversary mark this year. Thank you. And in my office, my primary focus is GYN and women's health care, not so much on the OB scale, but just kind of getting young women and older women, just women in general across the lifespan, educated, knowledgeable, more so about preventative measures of how we can just kind of prevent things and take care of ourselves holistically, crossing Western medicine with holistic medicine, diet, exercise, lifestyle modifications, things like that, so that we can maintain women's wellness throughout the lifespan. So that's me, and I'm very excited here. I'm excited today to contribute.
For being the professional on the panel. I know that all of these ladies have some experience with something that's impacted them and their lives greatly. As Sophia shared, PCOS, and I know Allie as well suffers with PCOS. And I am a woman of a certain age who is experiencing, those menopausal impact characteristics to my life. Allie, why don't we start with you?
You're my mom, so I experienced your troubles at a young age. I'm not gonna I don't want to speak to all your things, but I did obviously see the things that you went through, the surgeries and just the trauma. And then I want to say about probably age 19, I started having severe issues, pain during sexual intercourse, and I was also a full-time student athlete. So I didn't pay for college. That was my, basketball was my thing. And there were days that I was like, I can't believe I have to go to practice and class. My body, I don't know what I'm doing. And so I want to say age 19 is when things were starting to, I started to have symptoms. And then I didn't get my first diagnosis until 25. So at 25, I was waking up in a puddle of sweat. And I had an Apple Watch, and it was telling me that I was burning 800 calories overnight. and I was like losing a lot of weight, and then I was like really hairy, like not my usual. And then, that's when I got diagnosed. But I also was found out that I had fibroids, endometriosis, and PCOS. So that was kind of my first experience, and it was like a triple whammy.
Yeah. Well, thank you for sharing that. I think maybe Shaytonya, I might just get some clarity from you for those that aren't familiar with the things that Allie has shared with us. What is PCOS? What are fibroids and endometriosis? And, maybe sharing like some of the symptoms, maybe beyond what Allie has shared with us.
Right. So yeah, definitely three triple whammies to be diagnosed with at the same time. So I wanted to say that it's not abnormal that you were diagnosed 5, 6 years later. Unfortunately, sometimes these things are hard to diagnose. Not because they're hard to diagnose, if this makes sense, but sometimes providers, unfortunately, don't listen. I'm sorry about it, but I'm not surprised that it took that long because unfortunately, this is where we are. We've gotten a little bit better. In when it comes to women's health, we have to, especially as Black women, we have to advocate for ourselves. So starting with PCOS stands for polycystic ovarian syndrome. And literally there will be little tiny cysts inside of both of your ovaries that prevent you from ovulating. And if you're not ovulating, then you're not going to get your period monthly. And so if there's no period monthly, then there's, further risks of endometrial cancer down the line. Because of the PCOS, there could be a hormonal imbalance. We don't know which one started first, but Ali, like you said, the heart racing, the hair growth, things like that, most likely maybe some weight gain, irritability, things like that. So I would say PCOS sometimes is a little bit easier to diagnose because we can get an ultrasound, to look at the ovaries. Sometimes your blood tests will show, but sometimes all of those things will be negative, so to speak. When your tests are negative, it sucks to hear, but a lot of times the main treatment for it is birth control, whether it's a pill, a patch, or a ring. But I feel our community is a little reluctant to start birth control, but I also feel like providers aren't providing enough education on the background and why it's important, and it doesn't have to be a lifelong thing. It can be temporary, while other measures are taking place to kind of try to reverse the PCOS. You mentioned fibroids. Fibroids are benign tumors that grow within a woman's uterus. And we know that Black and brown women are 80 to 90% more likely to develop fibroids, these non-cancerous tumors that are there. We don't really know why 100%, but mostly we can say it's because of our diets, maybe our ancestry, simply being misdiagnosed at an early age, right? When we think fibroids, we think a woman maybe in her 40s, late 30s, but you can absolutely be 21 and have a small fibroid. And that small fibroid can contribute to your heavy periods and to your pelvic pain. And if you're going to that provider that's like, oh no, that's normal, that's years of hearing by the time you turn 35, 40, years of hearing that everything was normal. And then all of a sudden you go in and you get an ultrasound done and you have a fibroid the size of your head. And then endometriosis, one of the hardest things to diagnose, because again, same thing goes back to it. You tell your provider that you're having these symptoms and they tell you that it's normal. But the truest way to diagnose endometriosis, and with that, you're experiencing the heavy periods, painful intercourse, bloating, irritability, heavy periods. I believe I may have said that with clotting, rectal pain, back pain. It's just, you know, could just be regular periods, but a lot of times when you do these tests and everything is normal, you could have endo. The fact that you had all three at once, girl.
Well, to be clear, I got diagnosed with PCOS first.
Uh-huh.
Then they gave me birth control. And then once I got on birth control, it was unfortunately the depot shot, and that made me bleed for 7 months. And then they had to go in, they cauterized fibroids. And when they went in laparoscopically, and that's when they found the pockets of endo. So it was kind of like
Mm-hmm.
a I
Yeah.
said that wrong, but yeah, I do
No,
know
it's
what.
okay. Right. Yeah.
But yeah, laparoscopically is how they found mine at least.
You mentioned reversing PCOS. And I just had the question, I wrote down how so? Is this something completely reversible, or is it something that, as you said, you really not reversing, but so much as modifying it based on your lifestyle and the choices that you make?
In certain instances, it can be reversed. I've had patients that listen to pretty much all of my instructions, whether they are holistic instructions, medical. A lot of times it's weight loss, simply weight loss, losing 10 to 15% of the body fat. And then, doing a ultrasound a few months later, a year later, and those follicles have now gone away and the patient is ovulating again. So, with maintaining those healthy lifestyles and dietary measures and holistic measures and possibly being on a birth control for a little while, things like that. Yeah, it can be reversed,
Thank you still for being here, ladies.
of
I
course.
wanted to just kind of shift to Sophia. Allie shared her experience and it was kind of layered, right, with multiple issues. Tell us a little bit about your experience with PCOS.
A lot of what was already said, I certainly experienced growing up, but from a younger age. So I remember having an ultrasound done. I was probably I was in middle school, and they didn't really know what was going on with my body since all of the other girls in my classroom were already in menses, but I hadn't started yet. And while there's even uh, a cultural perspective to surrounding the age in which a woman should
Mm,
have her period, I guess here in America, that was seen as abnormal for me to be 13 without having my first period. So I was put on birth control to induce my first period. And that was around the first time I'm even learning about PCOS. I had no idea that a lot of the symptoms I was dealing with growing up with fluctuating weight and facial hair was because of this condition. And the remedy at the time was birth control pills, and I believe largely it still is. But there may be some other newer medications now that are out to mitigate it. But there wasn't much that could have been done back then for me. I remember my doctor had also said that there is no cure. So already I was going into this with a defeated mindset. My instructions for taking birth control was to take it forever until I'm ready to have a child. And so that was a lot for me to process as an early teenager.
yeah.
And of course, my family didn't have an education surrounding what PCOS is and how to treat it for me. And so we were in the dark for a long time until I started recently picking up literature, researching, listening to the healthcare professionals about what PCOS is at its root, because I feel intrinsically there must be a way for me to mitigate all of these conditions that I'm feeling, because I can't certainly live like this for the rest of my life. I think one of the more serious symptoms for me were the dysregulated mood. There is the physical aspect of illness, but there is also the psychosocial aspect of illness, where it affects your mind and it affects how you interact with others, affects whether you want to leave your room.
Mhm.
And all of these things could have been attributed at the time to now PCOS. And so now I'm like, there's an attack on my body, but then now there's also an attack on my mind. And there's no way I there's no cause. I have to find the cause. And so I delved into the literature, listened to healthcare professionals, and indeed, much like what Shaytonya said, it is largely for recovery about your lifestyle. So I know that what's out there works. If you change your diet, if you change your mindset first to that you can overcome this and that you won't be with this condition for all of your life at the severity that you may be experiencing at it now, then there's hope for you.
Yes, congratulations.
Mhm.
Shaytonya, I want to flip that back to you in your practice, right? Which
Mhm.
you see the whole woman. Share a little bit about how you work in your daily practice in meeting the needs of the whole woman.
So I had a patient today, actually, a young woman, 38. And she came to me because she believes that she is going through perimenopause. She said she has brain fog, she has fatigue, lack of sexual desires, um, irritability, mood swings. She feels like she has some hair growth, just all the signs. She's sweating at night, all these things. And so we go through her history because we always get a good history and physical in the beginning. We do a physical exam, all the things, pelvics, whatever, whatever. So as I'm talking to her, of course, the first thing you do when you're assessing is you're looking, right? So I'm looking at her. And when I asked her about her menstrual cycle, because she thinks she's in perimenopause, I'm like, is your period skipping? She's like, nope, it's coming every month like clockwork.
Mhm.
And so to me, that tells me, nope, so you're not in perimenopause. When you're in perimenopause, things start moving around. I'm not thinking PCOS because her periods are coming monthly, like clockwork. We know PCOS, you're not going to get it a few times a year. So I'm just looking at her, I'm looking at her. And so the presentation is that. Oh, also, a little social history. She works from home, right? Started working from home via COVID.
Mhm.
So I go into my first thing is always, all right, what's your diet like? And then I get to look. I'm like, are you eating this? Are you eating that? Oh, I don't eat that like that. When somebody tells me they're not eating something like that, that means you're eating it like that. That's always
Uh-huh.
like, I don't do that like that. Yeah, you do it like that. So in talking to her, and I'm always gonna do a full workup because I listen to everyone. You think you're in perimenopause? We are going to do all the perimenopausal labs. But in looking at her physically, and then taking account to her history that she now works from home and has been working from home in the last 5 years, and that she's put on a good 45 pounds,
Mhm.
right? She's not really going outside like that. She doesn't exercise, what she admitted to me. Her diet was not the best choices at all. She's a snacker. She doesn't drink water. And I'm just like, you're not in perimenopause, like respectfully. You're overweight. There's working from home for me was a gift and a curse because we don't have to worry about ordering out or whatever. The food is right there in the refrigerator, you know?
Mhm.
And even though when it comes to drinking water, you would think that we have more access to it, but we're not really drinking it, when it should be the opposite because the bathroom is right down the hall. So I just kind of went over all those things with her and she got it. She understood.
Women need to understand that you have the choice in who you choose that cares for you.
Absolutely.
I think definitely, Sophia, your generation is more aboard with saying, yeah, no, that's not for me. Where my generation was like, okay, this is my doctor. Whatever my doctor says, like I'm learning now to say, hey, like I may have been uncomfortable with things in the past, but you're like, well, that's my doctor. Where now, and Shaytonya, you said it, you can go and talk to another doctor,
Sure can.
see another nurse practitioner. I mean, that's another thing. I actually probably see more nurse practitioners than I actually do physicians.
Right. Yeah. Yeah, we're out
Right.
there.
And I love you all.
We're growing. Absolutely. As nurse practitioners, we still bring that bedside manner and that compassion into, how we treat our patients when we take care of them on a primary care level,
If something feels off or you feel like you're not being heard, or a question's not being answered, right? Because that's two different things, not being heard, and then you're asking a question and it's just like washed over. Seek another doctor.
Right.
Please. I found a lot of my history in terms of family history. I remember hemorrhaging to the point where it was just like, I used to pray for my periods to take place on the weekend so I didn't have to be at work. Or if I was at work and I was sitting down, I didn't want to stand up. Now, you all know I was an educator, so I didn't sit a lot. So it was like in the middle of a lesson and you feel that rush and you're like, oh my God, I need to leave the room. And I know I'm not alone in this. I know there's a lot of women that experience that. And, I was given several options, but maybe I'll defer to you, Shaytonya, instead of me just sharing. I said what I did, but there were many options, and there are many options.
Before I went into that, I wanted to know what were the options that were offered to you outside of the partial hysterectomy, and what made you, and if you tried them or not.
So I had a myomectomy. I did have that with my GYN. Just over time, I was right back where I was. And then I saw one doctor had talked about doing the ablation.
Mm-hmm.
Ablation. And I was just about to do it. And I decided not to. And the reason for that was I do have a younger sister who does have a history of some severe issues vaginally. And I was hoping to maybe carry a child for her, be a surrogate. That never came to fruition. And then I got to a point where, I just progressed in age and discomfort. And my doctor kind of said to me, are you having any more children? Because I am a mother of 2 children that I birthed. And I said, no, please no, not at this point in my life. And he said, well, maybe you want to talk to a doctor about possibly doing a partial hysterectomy. And also taking into account, this doctor knew my mother. My mother at 39 had a hysterectomy due to the same issues. So those were some of the things that helped me make that decision.
I have friends, I have patients, who suffer from fibroids and some of them are privy and want to do procedures, but before that, everyone just opts for the iron infusions. And I'm like, listen, we can put in all the iron you want, but if in 28 days you're gonna bleed it all back out, we have to come up with a plan. So fibroids can be within the muscle layer of your uterus, those are the ones that cause a lot of pain. You can have it between the mucosal, or what they call the serosal layer, and those ones cause heavy bleeding. You can have some that are kind of on a stalk hanging off, those ones cause pain. So first line of therapy, if we're gonna go the medication route, a lot of times, we will talk about a low dose birth control, and it does work to control periods, but scientifically, for me, being on a birth control pill for a long period of time for fibroids, I always battle with, is this little dose of estrogen that we're giving, is this going to help this fibroid grow a little bit over time? There's medications that are specifically for women with endometriosis and heavy bleeding from fibroids that will help control that. But sometimes those medications can have a side effect on certain patients, right? So it's not for everyone. And then when it comes down to the surgical or non-invasive procedures, you could have the myomectomy like you had, but as you said, if you get it at a certain time, depending on your ancestry, depending on your body, that fibroid just may grow right back, right? The ablations oftentimes work. So it's a lot of things that go into the decision to have a surgical that's invasive or non-invasive.
You could do a uterine fibroid embolization where they go in and find the artery that supplies blood to the fibroid and they cut off that circulation. And then over time, that fibroid can shrink. But that recovery can be a little painful, right? But when you're 35 with no children, is that really an option for you? And even though some 35-year-olds right now are like, nope, I don't want children, I would not advise. A lot of thought has to be put into what your treatment process is like when you have fibroids. But for a woman who does suffer from them and is severely anemic and getting IV infusions weekly, something has to be done.
I guess it goes back to what we were saying before also, having the kind of relationship with your practitioner that allows you to be open, and they make you feel comfortable and heard, because that's probably one of the reasons I bounced around as well. I think, me having already had children, listening to my family history was really a part of that decision, and my practitioner really helping me to see the full picture.
Listening to similar characteristics between your recovery process and the recovery process for PCOS, and I'm starting to see, yeah, a lot of these issues are linked. And so that's what makes this women's health just such a fruitful conversation.
Thank you. Thank you for that. All right. And then my last question, only because it came up with PCOS, it came up with the fibroids and the subject of birth control. Mm-hmm. So what are some alternatives for people like me who struggle with those doses, even the lowest dose of birth control, in addressing PCOS or fibroids, and that's not an option?
That's a weighted question, because the first line of therapy is birth control. And like I said previously, for someone who can tolerate it, because everyone's body is different, as you saw with success rate is amazing. You have decreased bleeding, your flow is shorter, lighter, no pain, all good, right? But there are cases where patients can't tolerate it, and that's okay, whether you feel the symptoms that you felt, or some people get really moody on it because it is a hormone, right? So it can affect your mental health. Definitely everyone's not a candidate. Like if you're a smoker, if you're over a certain age, even lifestyles. Like if you're there's different types of birth controls, right? So for someone who has PCOS that isn't able to take a combined birth control method, and by combined I mean a birth control pill that has estrogen and progesterone, or a patch that has estrogen and progesterone, or a ring that has estrogen and progesterone. For someone who can't manage that, we're definitely going to focus on dietary changes for sure. Removing the simple sugars, removing the refined sugars, even, in our cultures, we love eating rice. With every meal, we got to have a half a plate full of rice, right? Because we love it. No, when you have PCOS, you cannot. So first, dietary changes, but then for a woman who needs to see that shedding, right? Because like I said, I mentioned before, having PCOS and having irregular periods, if you're on a combined birth control, it's the birth control that's going to induce the bleeding monthly when you go through those withdrawal weeks. But for someone who's not eligible for that, along with the dietary changes, we may give another hormone monthly or every other month that can induce the shedding that you want. Because with the PCOS, it puts you at risk of endometrial cancer. When we're not shedding those cells, you get the proliferation of the endometrium over time. And then that's how a lot of women who are postmenopausal start having irregular bleeding afterwards, because those cells, they're there, but they never wanted to be there and they got stuck. And all of a sudden, for some reason, it's like, yeah, let's make our way out now. With fibroids and heavy bleeding, there's medications that you can do monthly that kind of work on the clotting factors that will prevent you from bleeding heavily. That's called tranexamic acid, but everyone's not eligible for that either, So again, in those patients, we try to go more so for the surgical or non-invasive procedures to control that bleeding, like the ablations or the UFEs or anything like that. And of course, diet. Diet is always going to be number one. And even newer studies came out, I believe a couple years ago, that said that low vitamin D is linked to fibroid growth. And then the same for endometriosis. There's different medications outside of a birth control, but just kind of managing symptoms, if it gets really bad, then that patient may have to have the laparoscopic surgery, just to go in and have someone take a look and clear it all out. It's just about confidence, being confident in your team. Like I said, like we keep going back to choosing the right person, you know.
Yes. Well, thank you. You actually just wrapped up and summarized. I love you, and thank you so much. Just, some of the pointers. Women, remember, choosing the right providers, all right, that make you feel confident in your body and the choices that you're making for your body. Looking at your health holistically, right? Because everything is connected. And being able to manage your diet and exercise, how important that is. We hear that all the time, but it's true. We hear it all the time for a reason, and how that impacts our health. And then, lastly, which we all kind of spoke to, is heredity and also cultural influences, right? To yourself, and knowing these things and how they can impact your health.
I do have one more thing I want to add.
Absolutely.
It is all good with second opinions, right? But make sure you come in with what the other providers have suggested to you. If you tell me that you went to someone else, I need you to come in with a diary. It's okay to have notes. I love when people come in with notes, things written down. On this date, I saw Dr. Jones and he said I needed XYZ medication. He suggested this, he suggested that. When you come in and you don't know where you've been, we don't really know where to take you.
To add to what you're saying, I think it's important to keep a health journal, especially when you have an ailment like we've discussed today, to keep track. Oh, I bled for 5 days, or I only bled for 3. I skipped a day. All of this information is so valuable to take to a doctor to address you, because even though we're talking about ailments that several women may have, the way it impacts your individual body is going to be different than the next.
Now I want you to keep a diary.
Right. Yeah. I thank you again. This has been our first Thrive Talk, and women's health is so important. I hope that you all learned quite a bit of information today. We can follow up with providing you any information or documentation that you need. Know your bodies, know yourself, and we wish you well.